summarize, we kind of talked about, hi Kate, I was just giving
Hi.
a quick summary of what we did last time. We talked about kind of like the when, why, and how to use neck bracing for hypermobility. And today we're kind of going transitioning into kind of some of the pitfalls that can exist with using bracing, and things that we can do to kind of like mitigate some of the problems that might arise if you're using neck bracing for your hypermobility and neck pain.
Yeah, absolutely. I'm really excited to dive in.
Yes. Yeah, I saw you shared a little bit yesterday about that, but I think from both of our perspective, we look at bracing as a way to provide relief and support for those with hypermobility. But now we're going to look a little bit more at the downsides about like what can happen if it's overused or not paired with exercise. And this conversation is kind of talking about how to balance kind of the problems with it, and mitigate them as much as possible.
Yes.
So what are, as somebody that uses a brace, what are some things that you have seen as that can be arise as problems?
Yes. So I think for me, I have personally been able to mitigate more of the uh, deconditioning risks with my background as a physical therapist. But I have experienced issues such as irritation of my TMJ. I do have TMJ issues, and this is something. Oh, are you back?
Yeah.
This is something that can bother me while using a brace. So we'll talk about this a little bit later, but I do have a TMJ splint. It's like a bottom retainer almost. So that
Hmm.
helps me mitigate that. I'm definitely always wearing this when I am using my brace.
Yeah. Yeah, so I think the biggest thing that could be problematic or a pitfall would be the muscle atrophy or deconditioning of the neck with overuse of it. And that's always something I really make sure that I'm educating my clients and patients on when we talk about the use of either soft collar or hard collar to support their head and the neck, is that they need to be doing exercises as well to make sure those muscles stay strong, or at least we mitigate atrophy with that. They might not be getting stronger, but at least they're not getting weakened by use of an external support device, right? So with that, we're using different exercises, whether it's isometrics or isotonics, or using something while in the brace and doing some static contractions. What are some exercises that you typically do?
Yeah, great question. So, one of them, classic, is a chin tuck. The way that I typically do it is lying down with a towel roll underneath my neck. I'm making sure that I am activating just my deep neck flexors and
Hmm.
making sure that the kind of larger muscles like the SCM don't kick in and overcompensate because those are not the muscles that we're trying to strengthen
Yep.
or recruit. Um, and that one I have done in gravity minimized positions, like on a wedge. So I've progressed to more against gravity
Mm-hmm.
and, progressing from just the chin tuck hold to a chin tuck with a lift.
Hmm.
Uh, that's one of my go-to exercises that I've been doing for a very long time and progressing over time as I get stronger. I also have I should grab it. Let me grab my head harness real quick. It's right here. uh, so I also have this head harness from a company called Iron Neck. I'm not going to put it on, but it essentially just goes on your head and it has all of these loop attachments so that you can attach a resistance band. They also come with just like straps that you can hold to attach to them. So with this, I have progressed from my manually resisted four-way isometric holds to uh, more external resistance with a light resistance band. So I just hold the position and I'm walking out
Hmm.
different ways to address the four different uh, directions of resistance.
Yeah, that's really great. And then I know, do you do any exercises within the brace as well for isometrics? Because I know that was one recommendation in that in the article we kind of like use for this is that they're doing isometrics in the brace. Do you do any of that?
You know, that's not something I've ever actually explored, but I love that idea, especially if I'm going to be wearing the brace for a longer period of time. Like if I'm traveling, say I'm on a plane ride, I
Hmm.
think that would be something that would be very beneficial. I do like that idea. And I especially like that idea for people who, uh, you know, maybe are experiencing having more symptoms, and maybe they're tolerating the isometrics better within the brace.
Yeah. And another, I like doing some of the isometrics in the brace, well, for the hard brace at least, not so much with the soft brace. But I recommend that people do a couple isometrics, uh, either while they take it off, so that way, they get the muscles ready to engage and support the head again after a period of time where it hasn't been really working. So like you've had a break, okay, let's do like a round of exercises, get those muscles kind of like warmed up again to do what their active role is, and you feel well supported once you take that off. And I think that's another way to use exercise. To help with the neck and oscillate in between usage of the brace and taking off that brace.
I like that idea, the just kind of priming those muscles right before taking it off. That's a great idea.
Hmm. And then one of the problems with that, though, like we talked about doing the chin tuck, which is a great one for the deep cervical flexors. The problem with a hard brace is that if you're doing that chin tuck, you might be loading the TMJ. We said we briefly talk about that. So that is one problem with wearing the some of these braces is that your chin is resting on it, so it is pushing your mandible up into the head, into that joint, and that can cause some TMJ issues for people that do have a joint dysfunction. Now, if you have a TMD disorder, TMJ disorder where it's more myalgic and it's more muscle generated pain, you might not have too many issues with that. But for those that have arthritic related pain or discogenic related pain inside the TMJ, that's where bracing could be a potential hazard for you or cause some additional pain if we don't properly like use splinting like you have, or do some jaw exercises, or really readjust the position to where you're not loading that joint so much.
Absolutely. I am always adjusting with the Aspen Vista to make sure I'm not putting any extra pressure on my jaw. And sometimes that can feel different standing versus sitting, so adjusting
Mhm.
through if I'm moving positions when I'm wearing it. And again, using my splint. This is called a Bellavia Tanner splint. I have had two different TMJ splints made. The first one was by my orofacial pain medicine doctor. His background is in dentistry, but he specializes in TMJ and migraine. Uh, and the second one was made by my orthodontist, who has a special interest in TMJ.
Oh, that's cool. And do you find that wearing that brace does help? Like, were you having like joint issues with that, and the occlusal splint there was helpful for that?
Yes, so was having discogenic issues, and the use of this splint. So I don't only wear it. Obviously, I'm wearing it right now, so I don't only wear it in the brace,
Mhm.
but with the combination of using the splint, giving my jaw a place to rest, and also doing some exercises and limiting my jaw opening and a couple other different things, that has greatly improved. When I went to go back and get the splint readjusted, they checked and they said my disc was in a much better position. So that's, based on their findings. So,
Yeah,
and I've experienced an improvement in pain. Is that to say that my pain is completely gone? No, because I also have like myalgic pain there.
yeah.
Uh, so, it has definitely improved it. And there is a very noticeable difference in how my jaw feels when I'm in a neck brace if I'm wearing this versus if I'm not.
That's good. Do you find that like we talked about doing neck specific exercises after we take off the splint, do you do some jaw mobility as well afterwards if you're having stiffness or pain?
Yeah, my kind of go-to for that is just they call it like rocking like in the condyles, so just
Mhm.
gentle opening. It kind of looks like this, like
Is that
and some
where the tongue is against the roof of the mouth and opening? Yeah.
yep, so you're not opening too far, you're only opening as far as you can with your tongue on the roof of your mouth.
Hmm.
Sometimes I'll also do this in front of the mirror. I used to have like jaw tracking issues. So if I do it in front of a mirror, that visual feedback helps me
Hmm.
stay centered as well.
That's great. Yeah. I think that's like what the big, I think those are the biggest two problems for bracing, is that we're worried about muscle atrophy of the neck, so we want to be doing isometrics and strengthening exercises, in either while you're wearing it or in between sessions of wearing it. It depends how we're wearing it for your specific issue with hypermobility, but usually it's you're doing daily neck strengthening to make sure you're increasing support and control. But at times when you need the brace, like you're sitting for prolonged periods, your neck muscles are getting weak, you're within traveling, that you're using the neck brace safely for yourself so you can re-engage and stay active within the life you want to kind of live. But we also want to mitigate as much risk as possible.
Yes, there's a lot of give and take because using the brace definitely has improved my quality of life and access to things because I'm, maybe able to do a little bit more. We talked about this in uh, the previous video, but also, making sure that I am doing the things I need to do actively in
Hmm.
order to, marry those two concepts together. And I think it's easy to not want to do the work part.
Yes, but I don't think it requires a lot of work, and I think people overestimate what is actually entailed. Like for what I do with headache disorders, the research kind of points to like if you're doing 10 minutes a day of neck and shoulder specific training, that's helpful for improving neck stability, decreasing neck pain, and decreasing headache frequency. And I kind of overlap this with neck bracing, right? Like sometimes we use neck bracing. Okay, we just exercise. Let's give the neck a break before you go back to work. Or you've been working all day at the computer. Let's wear the brace for a few minutes afterwards and then go exercise to make it feel strong. It's layering in exercise, using support as needed to really mitigate symptoms so you have a better quality of life. But it kind of using that is kind of like an art. It's kind of like where does it fit in your lifestyle? How do we fit in exercise? How much exercise is appropriate for you? Because sometimes we need time to get acclimated to it, right? Yeah, ideally we'd like you to be doing 60 minutes a week, but I don't know if you're able to tolerate that. So let's work on finding where you're currently at and then progressing towards that over time. So that way you don't need the brace as much.
Yes. And for example, I started with, you know, gentle manual four-way isometric. So I'm just gently resisting against my head in
Hmm.
all directions. And I would do that, a 5-second hold, just kind of go all around for a minute or two.
Hmm.
And, in the beginning, I could really only tolerate a short period of time. Now I got up to like 4 minutes. So then I progressed to the head
Yes,
harness.
a
But
lot.
right, it is a lot. And it's interesting because when you look at is it the Maldoni protocol? One of the EDS, no? What is
Oh, I
it?
don't know.
It's one
Never
of
heard of
the
it. I'll have to look it.
it's one of the EDS protocols. They want you to start with 4 minutes of those neck isometrics. So I think sometimes it's important to personalize because that's a lot.
Yeah. Yeah,
um,
The Muldowney protocol. Yeah. Okay.
Yes.
I see it.
Yes. So that's something that I think is important to, and that's something me and my physical therapist have talked about. Like, it's not all one size fits all. You really kind of have to meet yourself where you're at and kind of
Hmm.
figure out what's best for you. If your exercise sessions are consistently setting off symptoms and and so forth, then you might be doing a little bit too much.
Hmm. Yeah, and I think that's a good summary of kind of what we're talking about. The end goal is really to, you know, provide bracing to support the neck, decrease pain, but also to help you with self-management, and then introduce movement for further support so you don't need those self-management tools as often, or even use exercise as one of your self-management tools. So really that the goal is to retrain, build support, increase functional capacity so we're less reliant on that brace over time. Now, again, some people, depending on what their instability is and their conditions, maybe that brace is always a part of that, but maybe now they'll have less pain due to it, and they'll use that brace as a way to mitigate pain and improve their quality of life.
Yes. So, we were kind of discussing, aside, not on here, but
Yeah.
previously, functional versus structural instability,
Hmm.
and how, the understanding of the difference between those two may, justify difference in use.
Yeah.
So, for structural, I have structural instability,
Hmm.
with having hypermobile Ehlers-Danlos syndrome, I have ligamentous laxity. So for me, bracing might be a part of my routine, but it may decrease, the use may decrease over time as I get stronger, which is the hope.
Yes, yeah, exactly. Where like when I'm using it for somebody with like a functional, which is what I see often with migraine, it's like they have a lot of mobility, but it's not a structural. There's no structural issue. They have a lot of mobility, and when you have a lot of mobility, you need a lot of motor control and strength to control those end ranges. Well, with their jobs and what they do, the neck gets really fatigued. Okay, great. Your neck is getting tired. It just needs a break, like if you were walking all day on your feet. Let's offload that weight for a little bit, have a rest break, and then get back into it. And that's kind of like where there's different perspective and different ways to do it. And with the kind of the functional, it's like my goal is for you to not really need it at all anymore, or maybe just during like time periods of travel or like where your neck is really painful or maybe you were ill or got weak all of a sudden or had an injury, it's like okay, we'll go back to using it for symptom management, and then when I'm done having symptoms, I won't need it anymore. And it's just like it's kind of in a closet just in case.
Yes,
So
absolutely.
good. um, Kate, anything else you think we should share? Any other pitfalls we haven't covered yet regarding some of like the hidden risks around neck braces and how to avoid them?
Hmm. I think that sometimes something we haven't discussed is a psychological dependence. So that I think sometimes we can form a bit of a psychological dependence on that external support. So I think it's really important to discuss, the that with your provider, and for your provider to discuss that with you. I think we see this sometimes with other injuries too. People have that little bit of mistrust in their
Mhm.
joints and their body, and maybe a willingness or a tendency to want to hold on to that thing that is, supporting them. So that's something, just one thing that popped into my head that we didn't touch on.
Yeah, that fear-based avoidance or the kinesiophobia that can arise with chronic pain and chronic conditions that you're afraid to move the neck. And we want to, I think something we would both probably say is that like we don't want you to feel dependent on the brace. We want you to use it as a tool and learn how to manage your symptoms with it, but we don't want you to feel reliant on it. And actually, if you are reliant on it, it probably means there's an issue and you need to see have a surgical consult for it. It's really that unstable. And I've seen patients that have gone that route before. And that's just something that you have to bring up. But we always want to, at least from our perspective, we're kind of looking at it from the functional side. It's like our goal is to not make you dependent on it. It's to give you confidence to make the decision on I really need this right now, or I don't need this right now. And I need this right now, but I know if I do, X or Y or Z, I won't always need it every time I do this.
Exactly. And being able to marry those two is, it's a tool in the toolbox, the bracing is, and the strengthening is a tool in the toolbox, and an even more important tool, I would say. but it's important that it's just one piece of your management. Now,
Mhm.
I will say anecdotally, I am now going through the process of, seeing if I am a surgical candidate for upper cervical instability. So for me, I'm not sure what my bracing journey is going to look like going forward as I, get that imaging done and XYZ. But I am grateful, regardless of going into it. I'm grateful for my use of strengthening and bracing, because if I do have to have surgery, the stronger I am, the better I will come out of it.
Yeah, the better the recovery, the stronger, the less symptoms you might have afterward. Yeah, all of that.
Yeah,
That's where like even after surgery, patients still need to do strengthening for different reasons, but it all helps goes back to pain and feeling secure in your body.
absolutely. Yes.
Right, Kate. No, I think this is a great conversation. I think those are all the big pitfalls that we have with everything. We talked about
Too.
what was that?
I think so too.
Yeah. Like the big issue is that neck muscles getting weaker, the TMJ becoming irritated, and if that is happening, adjusting the brace, looking to get a TMJ orthotic if necessary, and then maybe doing some light, gentle TMJ exercises could be helpful as well to maintain mobility and reduce that stiffness that comes with it. And then also managing wear time appropriately for what you need on the certain type of occasion that you're going through.
Yes. Now, a question in my question box. Let me.
We can't hear you.
So sorry.
It's all right.
let me just let me just find the screenshot really quick.
Okay.
Okay. So the question was, how do I know if I need a neck brace and what is an inexpensive option?
Yeah. I think the big indicators for me, if I'm listening to somebody talk about it, I'm looking for some subjective things they would say, and I'm looking for subjective signs of craniocervical instability. So those would be the desire for external support. So using your hand to hold your head up, or if you're positioning yourself in the sofa to where you're like wedging it in the sofa cushions, or something like that, like Kate's doing, some way you're propping your head up. A lot of patients, I have this where my chair is here, where I do like the subjective interviews. The chair is against a brick wall. Well, they will put their head up against the brick wall and it's unconscious. And I kind of have it there so I can see that without them knowing I'm observing that, right? Because it's really important. So that would be one, external support of the head. Another subjective sign would be the desire to self-manipulate. So cracking your neck is often a sign of cervical instability. I forget the exact reason or mechanism for that or what they think is going on, but that is one of them. The other is a feeling of bobbleheadedness, or lightheadedness, or like just like a disorientation to where like your head doesn't feel aligned with your neck and it just feels off. And then the other one, especially towards the end of the day, is like the difficulty bringing your head back up after a long day. Those are like the big ones I'm looking for. There's a big list from a study that like looked at all the subjectives, but those are like the most common ones that present the most often. So that's what I'm looking for. And then we can look at like functional tests for patients as well, like their deep neck flexor endurance test, deep neck extensor endurance test, and things like that to see how strong those muscles are. And if they're presenting with weakness, maybe that's the time we do some bracing based on what's going on.
That's a great answer. Yeah, I'm nodding and giggling because I have all of those.
Hmm.
And then the second question was, what is an expensive option for a brace? And we did cover the different kinds of braces in our previous video. So to avoid rehashing all of that, I'll just redirect whoever
Yeah,
asked that question to watch part one.
yeah. I'll go back there. We kind of go in depth on like the types of braces and where you can kind of find them. That's great.
Yes.
Great. Were there any other questions from your inbox? Just
That
those
was
two?
the only question I got. Yep.
Very good. Well, that's great. Well, thanks, Kate, for joining me today and talking about neck bracing and hypermobility and for the second part. It was great talking with you today.
Yes, thank you so much for having me on. I've loved collaborating on this project, and I hope whoever's watching this, either live or on the replay, gets some actionable information out of these two videos that we've put together.
Yes. Thank you, Kate. Have a good day.
Thank you. You too. Bye bye.